The video you are about to watch has been created by perioperative staff at the Cape Breton Regional Hospital in accordance to COVID-19 information from the Nova Scotia Health Authority. The information used was current as of March 27, 2020. Recommendations on how to care for COVID-19 patients are rapidly changing. It is important to review recommendations frequently, as what we present today may change. The information in the video pertains to the OR theatre at the Cape Breton Regional Facility. Use of the video is permitted elsewhere, but please recognize that your facility may have different guidelines. It is to be noted that because there is a limited supply of PPE equipment during this pandemic, personnel did not use real N95 masks to make this video. The bottom of each doorway is lined with a flannel blanket for intubation and extubation periods to limit the amount of aerosolized particles seeping underneath. This case cart will be removed from donning room once all personnel have their PPE on. A Level 4 gown is required for airborne precautions. Patient will be wearing a surgical mask for transportation. The anesthesiologist and nurses will review the chart for pertinent information prior to entering the OR theatre with the patient. In an ideal situation, it is recommended to limit personnel in the OR theatre to anesthesia and 2 nurses for intubation. After medications are given, we are going to wait 50 seconds before intubation to allow for the patient to be paralyzed. If patient condition allows, it is optimal to wait 21 minutes for proper air exchange and removal of aerosolized particles prior to surgery. The walkie-talkies are used for necessary items and charting purposes. In our facility, we are able to use an empty OR theatre as a shortcut between the inner corridor and the outer corridor. It is important to remember the only difference in treating a COVID-19 presumptive or confirmed patient is the 21 minutes following intubation and extubation. During the remainder of the time, the perioperative team are to adhere to the usual NSHA PPE, droplet, contact, and airborne precautions. While COVID-19 is a novel virus, the precautions you are required to take are no different than when interacting with other patients on contact, droplet, or airborne precautions. The key difference you will see is the 21 minutes following intubation and extubation for COVID-19 positive or presumptive patients. Please remember, information relating to this virus is changing daily, so it is important to stay up to date with information via the Nova Scotia Health Authority website or reputable provincial sites.